Hi, everyone. It is the next episode of our podcast, Head to Total. Today, we're pulling back the curtain on orthopedics and sports medicine. So this is going to be a great conversation. My guest today is Dr. Katie Rashid from Mendelsohn Kornblum Orthopedics. Hello, Katie Rashid. How are you?
I'm doing very well, Colleen. How are you doing?
Thank you for taking the time because I know you are wicked busy right now. It's spring in Michigan and everything is blooming and everybody's going outside and it's bats, balls, and bruises, right?
It is definitely. It's that time of year we really start to see a lot of the people that have been kind of cooped up all winter and they're ready to get back to their spring and summer activities, baseball, softball, golf, running outside. So all sorts of things.
So I got to give our audience a little bit of an introduction about who you are. And when I met you 4 or 5 months ago, I was fascinated because it's a female in the field of orthopedics, which is rare. Could you talk to us a little bit about why orthopedics and why you went into this discipline?
Absolutely. Growing up, my uncle was an orthopedic surgeon, and so kind of seeing his work balance lifestyle and how he seemed to really enjoy what he did because he works with a lot of healthy people, motivated people that, you can kind of make a difference relatively quickly, thinking that they have a broken bone or they have an injury and you can help get them back to doing what they want to do, whether that's gardening, playing a sport, playing around, with their kids in the backyard, their grandkids. It just seemed like a very rewarding career and, a way that I could incorporate getting to know patients really well as with obviously doing the surgery, which is very enjoyable for me as well.
So I do know you're from Southeast Michigan and you had known of your practice, Mendelsohn Kornblum Orthopedics, when you were younger, correct?
Yes. Ever since I was growing up, even in medical school, I would walk by the office building every day on my way to, my rotations that I was doing at the time. And it was always a motivating factor thinking I want to, be in an office like this, or obviously I'm in the specific office. So it's kind of a dream come true full circle.
Most people say it's a dream come true because you get to work with marketing people like Colleen Young, but we don't have to go.
Right. But we don't have to say that. That's a given.
No,
So
it's an understated thing. Yeah.
Yeah.
The other thing that I wanted to talk to you about for those that don't know you well is that you were a college athlete, basketball and
Yes.
softball, correct?
Correct.
So let's do a little throwback. So I'm older than dirt. Who was your favorite 1980s basketball team?
1980s. Well, it would have to be more of a retrospective if we're asking that, because I was my remembering teams was more of the 90s, but 1980s, you got to go with the classic Celtics, Lakers rivalry, Magic Johnson, Larry Bird. I have been able to watch old clips and films. It's actually one of the things I love to do is watch the old games on ESPN Classic and experience games that are memorable, but I wasn't either alive at the time or too young to appreciate them.
Okay, so I remember I watched it live. And I've got to tell you now you're my new favorite because I was a huge Boston Celtics fan. Firmly believed that it was a team sport, all the passing that they used to do. Michael Jordan to me ruined the game of basketball. But as a Celtics fan, I'm obligated to say that. But I think one of the things that I have learned when I watched your video was you take that team mentality and you apply it to your patient care, right? And being a leader. Can you talk to us a little bit about if I have an orthopedic incident and I come to see you, what's my treatment like with Katie Rashid?
Absolutely. I think like you touched on, one of the biggest benefits of working in any medical field, especially orthopedics, is you get to work with a lot of different people, a lot of different staff. And so the days can be enjoyable trying to make sure everything runs smoothly and efficiently. And, so if you want to come see me, we have a whole great team that can help get everything in motion for you and get you lined up to be taken care of and address what's going on. You get to see the X-ray technicians. They'll do a great job taking care of you, getting the X-rays, and then, meeting some of the staff that helps get some of the original information, see what's going on. And then obviously I think the best part is get to have a conversation with me and I like it because I get to know patients, and I think our office specifically has a very nice, comfortable, relaxed feel. People feel like they're getting good care, and everybody's pleasant, and for the most part, people say it's an enjoyable experience. But that's our goal. Going to the doctor is not very fun, but I think people don't mind coming to their orthopedic doctor as much as they do, other doctors.
I think there's such a misunderstanding. We've talked about it before on Head to Total. There's a misunderstanding when it comes to orthopedics. A lot of people feel like, oh, hey, I go to an orthopedic specialist when I've got grandma's hip or
Right.
something like that, right? And it's in your case, it's so a different dynamic because you're treating, athletes of all ages, of all across all disciplines. And I know one of the things that I've heard from some of your patients is you've created a relationship with them, right? You dig deep and find out what the connection that you can make with them. Can you talk to us a little bit about when you were a college athlete, you decided to go into orthopedics, but you featured sports medicine. Can you talk to us more about that and what really is sports medicine?
I agree. Sports medicine can be a common, misconception. People think that you only deal with high level athletes, you only deal with college athletes, high school athletes that get injured, on the practice field and in the game, on the court, on the field. And it's really a lot more than that. We take care of everybody from the 2-year-old that's running around the house and slips and has a fracture, all the way up to the 92-year-old that is also running around the house and falls and slips and have a fracture. But we also take care of everything in between, from shoulder surgery, rotator cuff surgery, knee surgery, knee injuries, not necessarily even surgery. But we see people that are just recreational athletes or people that get injured that don't have it, a sport or an activity they're doing. They just slip on the curb and have an accident. So it's a lot more than just getting injured while doing a sport or a hobby. We can take care of pretty much anything that people get when people get hurt.
Talk to me about springtime and what you're seeing in Southeast Michigan with respect to injuries. What are you seeing the most of right now?
I would say this time of year is soccer's ramping up, or even coming down to getting towards the playoffs. We see a lot of soccer injuries, which can be ACL injuries, meniscal injuries, just knee sprains, ankle sprains. Now people are getting back to golfing, so they're kind of getting back into the swing of things, no pun intended. But when they start getting back out to the driving range, they kind of overdo it because they haven't done it in a while, and so we see a lot of people with just general shoulder complaints. And then obviously kids are getting outside more, so we see kids falling off monkey bars, going down slides and hurting themselves, jumping off of things their parents told them not to jump off of. So we see a lot of a good mix this time of year, which is exciting for me.
I think one of the things too, when I was a kid, just like you said, I was doing something my parents told me not to do, which was jumping on my bed. I fell backward and I dislocated my arm, right? And I remember going to the hospital. I remember going to the emergency room, and then I saw an orthopedic specialist. And I got to tell you, I think once that happens, you then stick with that orthopedic specialist throughout your entire life. Do you find yourself, as you're starting the practice, that you're seeing some younger patients and that that's the relationship? You're going to see that person when they need, a hip replaced or, they have something happen to their wrist. Is that what you're starting to see?
I do, yes, and that's one of the things that I enjoy most. One of the things I love about orthopedics is that it can be kind of a lifelong relationship, or a family affair where we see. I've had many patients where I've seen, let's say, the patient then sent her husband to me or her brother or her mom because they had an enjoyable experience here, and I love having those connections and getting to build those relationships with people where they come back for multiple things and you get to know them, you ask about their families, what's going on in their life, and you kind of see them progress as they go through life and as I progress through my career. And I think it's a exciting thing to think that there's people you see now that you could still be taking care of in 20 years for the same problem, a different problem.
Mhm. Do you see, and I know you have 3 different offices. Do you see across the different offices, are you seeing different demographics and are you seeing different injuries in the different locations that you're at?
I would say for the most part, I see, similar things in most of the offices. The offices in West Bloomfield and Livonia seem to be sometimes the more of the kids that I see, more of the adolescents and the younger kids. But it's probably just luck of the draw. When I'm on call and when kids come in more to the office when they have an injury versus an adult that has more of a chronic situation that kind of has a scheduled appointment.
Okay. And correct me if I'm wrong, but you're practicing conservative care and conservative treatment options all the way through major surgery. I could come to you whether I need a hip replaced or if I fall off the monkey bars at the age of 49, I could still come see you and you could just put some ice on it if you will. Am I correct in saying that?
Absolutely. We see in a given day, I'll see people that need just a little reassurance. They need me to look at the x-rays or their MRI and say everything looks good. You're all set to get back to doing what you want to do. And then all the way up to having discussions about needing a total knee replacement, a total hip replacement, and ACL surgery. For example, I had a gentleman I saw a couple weeks ago, and he had an AC sprain. He had a fall and had shoulder pain. I told him, I think you're going to be okay. I'll see you in 4 weeks. We'll see how you're doing. You can get back to doing what you want to do activity wise. And then 2 weeks later, he came back in because he tore his ACL. So you just never quite know. And that's why we take care of everybody and anything because, they're going to have other injuries as well. And then hopefully we can take good care of them for those things in addition.
The continuity of care that you could provide is so reassuring to a patient because then you do know them literally inside and out. When you're seeing these people for repetitive things. When when something happens, Katie, is there guidelines you could provide of when do I go to an orthopedic specialist versus, yeah, I think this could wait, and give it some time and it'll heal on its own?
I think every situation is different. If it's something, lower extremity, if you can't walk on it, if it's too difficult to put weight on, probably something that you should come see us sooner than later. If it's getting better slowly, little by little, even by the day, then that's usually a good sign. But I kind of always say we're here. You have us available. Come when you think it's right. It's kind of you can't wait too long. You can't come too, or you can wait too long, but you can't necessarily come too early to see us.
Is it true that if there are some situations where you've decided as the patient to wait, that causes a larger issue? Have you seen that?
Definitely, we definitely see people that wait, and then we kind of are a little behind the eight ball in terms of getting the treatment and recovery that we want after. But I see patients the same day. I'm always happy to see people that call in the morning and say, hey, I had a fall, or I hurt my arm. I grabbed out and reached for something, and now I have all this pain. And we get them in as soon as we can, which can be the same day a lot of times.
Dr. Rashid, we often talk about soccer, baseball, softball, basketball, but I had an opportunity to go to the Detroit Skating Club recently. And the Detroit Skating Club has hockey as well as figure skating for all ages. They just had their big show. And in their big show, it was so cute. They had children from the age of 3 all the way up to adults who are performing because they're taking skating for the first time. And as I'm watching this program and realizing, number one, I could never fit into any of the outfits, and number two, I'm not coordinated enough to walk on an icy parking lot, let alone, be on ice skates. I'm watching these athletes, they're jumping and they're falling on the ice and the impact they're hitting the ice with. Have you had the opportunity to treat a high school athlete that has really taken a nasty fall and fallen on their hip or twisted their ankle? And what's the protocol for that?
Yes, definitely. We see a lot of, especially with having the urgent care now, we see a lot of people, a lot of kids the same day. They come, they take a fall on the field or, like you said, on the ice. We get a lot of hockey injuries, especially the winter time, and probably not as much now that the summer is approaching. But they take a hard check into the boards. They're having pain. Their parents are worried, and they can conveniently come right to the urgent care and sometimes see me even that day or the next day. But definitely do see people that take a pretty hard check into the boards or fall onto the ground. Obviously, a little more painful in the winter when the soccer field is still ice, like it is today on May 2nd.
That's never good in May, but
No.
that does happen in Michigan. Yes. I think that one of the cool things that we have to bring up with you, right, is if you're a high school athlete, if you're a parent of a high school athlete, Dr. Rashid, you've actually worked with the Detroit Red Wings and you've done your fellowship. Correct me if I'm wrong. Can you walk us through that?
Yes, it was one of the most exciting parts of the fellowship, getting to work with the Red Wings. Being from, around Detroit, a suburb of Detroit, growing up my whole life, the Red Wings were good, the 90s and the early 2000s and after that. And so when I had the opportunity to work with them, I just said, man, I cannot pass this up. This is incredible. So getting to, obviously, I don't take care of professional athletes now, but getting to work with the athletes and the doctors that have been a part of their care for a lot longer than I was in the fellowship was incredible. I got to see how to just evaluate athletes right on the rink right after, and kind of seeing a variety of injuries and getting to translate that to the other levels of the college athletes that I take care of, the high school athletes, and down into grade school. So it's been a really a great way to have that experience translate into my practice now.
What I love is the fact that you treat all athletes equal, Dr. Rashid. To be able to come into your office and have someone evaluate me with the weekend warrior, which I'll play a game of softball and drink a beer on a random Saturday, and I'm going to get hurt. That I can come see you and you have all this great experience, and you're treating both high school athletes, adult athletes, and you've had the experience with professional athletes. Who wouldn't want to come see you? I mean,
Yeah, I think it's a perk for sure, because I can see, like you said, anybody from just the weekend warrior up until somebody that's not even a weekend warrior, just somebody that likes to go play tennis or golf, and then all the way down to the 5-year-old that was playing in their soccer tournament and took a kick to the knee or something like that. And it's enjoyable for me because I like the variety and seeing all sorts of different levels of experience and competition, and trying to figure out the best way to get them back to doing what they want to do as soon and as safely as possible.
is an older woman that is a weekend warrior and does occasionally play sports on weekends. If I come to see you, what's the one takeaway that when I leave your office, you're going to tell me, Colleen, don't do this, or Colleen, make sure you do this?
With any injury that we see, the number one thing I always harp on is ice, ice, ice. I really try to get, ingrain that in my patients' heads, as well as any family members that they have with them, because it's the number one thing that can help. It's cheap. It's relatively, it's helpful. Relative, not many risks with it. So that's the number one thing. And I think the other thing is just follow directions. Trust what I'm telling you is going to get you back to doing what you want to do as soon as we can get that to happen.
Dr. Rashid, I think one of the coolest things about you too is we all know I'm going to get hurt as a weekend warrior, but I could come see you for all my other ailments. I have arthritis in my knees. I've got, as I'm getting older, things are starting to change. And I could come see you whether my knee hurts, my shoulder hurts, right? I mean, there's a million things you're doing in your practice, correct?
Of course. I think sometimes because I did my fellowship training in sports medicine, a lot of patients may be deterred thinking, oh, well, I didn't get injured, playing a sport. I'm not an athlete. I don't even like sports. I shouldn't go see a sports medicine doctor. But I treat everybody and everything, when they have hip pain or knee pain or shoulder pain, just because they've been doing things their whole life and repetitive things. For example, today I saw a waitress. She's never been an athlete, doesn't even like sports, but she has shoulder pain probably because she's been a waitress for the majority of her life. And, so just want to make sure that everybody knows we see patients of all backgrounds that have, like I said, don't even like sports or know what they are, and they still have shoulder pain and knee pain and hip pain and get arthritis. And we're happy to take care of that or any other injury they have, just nagging things that have been bothering them for a while, or things that pop up overnight.
Good to know I could sit and watch classic ESPN and still come see you as my arthritis will act up.
Of course. And we can talk about that. We can talk about the classics while we take care of your arthritis.
Dr. Rashid, I know we had mentioned the Detroit Skating Club. I understand that they're hosting the national figure skating competition in July. Are you going to be there in some sort of capacity?
I do plan on it. I have been to a couple events at the Detroit Skating Club as well, and they're all really enjoyable to be a part of as a as a physician, being able to help take care of athletes that get hurt while they're there, and then also just even as a fan, like you mentioned with the event that you just went to. The younger kids are very cute and enjoyable to watch, and then the older skaters are very good, and it's very intense competition, and it's exciting to watch them get to show their passion on the ice, and then be there as a reassurance, and somebody that can help take care of them if they do get injuries. I think it's beneficial for the athletes as well as the parents to know that we're there and can keep an eye on anybody that gets injured.
It is. It's a great facility. It's a great experience, and for those that have the opportunity to travel to Southeast Michigan and visit the Detroit Skating Club, it's a fantastic family feel there, and we love being a part of it.
Agreed. I think it's a great partnership that we have, and looking forward to many years of working with the staff as well as the skaters, of course.
Dr. Katie Rashid, I can't thank you enough. This has been great. Great to spend some time with you. Would love to have you back and talk more.
Of course. Thank you, Colleen. I'm always happy to come chat with you.
Excellent. Guys, until next time, the next episode of Head to Total. Take care.